keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
The worldwide burden of atherosclerotic disease continues to rise and parallels the pace of lifestyle changes and increasing risk factors associated with industrialization. It is tempting to conclude that atherosclerosis is a disease of modern society and may not have affected our ancestors. Dr. Abdul Alam from Al-Azhar University, Cairo, in collaboration with Dr. Samuel Vaughan and Dr. Gregory Thomas from United States, performed whole-body CT scans in more than 50 ancient Egyptian mummies from the Middle Kingdom to the Greco-Roman period. Although they may not have expected to find much in way of arterial calcifications, the results of their study are rather intriguing. I have Dr. Greg Thomas from University of California, Irvine. Welcome, Dr. Thomas.
Thank you.
What did you find in this study?
Well, we were really amazed. We were given the opportunity to image 52 mummies, including those that other museums had given us. We imaged 42 at the Museum of Antiquities in Cairo. And among those 52 mummies, we found that 44 had vascular tissue that we could still identify, and 20 of those 44, 45%, had clear-cut atherosclerosis that we could see based on the calcification that was still in the arteries.
And what risk factors did they have? Would you really know anything about that?
It's hard to know what individuals had. We do know that there was no tobacco. There was obviously no electricity. So they must have been very active, certainly more active than we would be. They did have meat, however. They weren't vegetarians, but they did have lots of vegetables, grain, fruits. But they had domestic cattle, domesticated their gazelles, their antelopes. So there is some meat that they have. We just don't know the percentage of it is. But it would appear that the risk factors would be significantly less than we would have now at that time.
And if you found calcification and you think that the calcification in fact represented the presence of atherosclerosis, how do you know that this was present during the life and not was the result of the mummification process?
That was a question that we asked ourselves. As you recall from 5th grade Egyptology, natron was used. Salt and sodium chloride, or salt and baking soda and others were used to try to desiccate, to dry the mummy out, and could this be natron? However, when we look at it, the calcification was extraordinarily age-related. That, for example, that the disease that was in the extensive mummies, and we had two actually with coronary disease that was clear. In the mummies that have extensive disease, they were all over 40, for example. So if it was a natron leaching into it, it would have been age-independent. One of our most fun findings, our aha moment, was actually finding coronary disease. And 2 of our mummies, we call them ours, and we got very attached to them, did have coronary disease. One was a mummy from 1550 BC back to 1580 BC, so 3,500 years ago, that had right coronary disease, where we could actually see the calcification along the right coronary and then branching into the PDA and PLV below it, as well as left coronary disease. And this was a mummy who died, a woman who was a princess, died in her 40s. And to find that disease so early, in fact, the earliest known documentation of coronary disease, was really unbelievable and quite a surprise to us.
So would you have any idea if they had any symptoms of coronary artery disease, if they really had the disease?
Yeah. I mean, it's to think that we know something about a mummy from 3,500 years ago is just amazing to begin with. And so we obviously don't know whether these mummies had it. But interestingly, there is a medical text published in a papyrus called the Ebers Papyrus, published right about the time this princess had disease. And she had not only coronary disease, but carotid, iliac, aortic, and peripheral leg disease that described in this text 2 physicians that if an individual had pain in their breasts, pain in their arms, that it was death-threatening them. So not quite Heberden's description, but about 3,000 years plus before. So the fact that I expect it's likely that some of them had symptoms given that discussion.
And any other areas of calcification in the heart, say for example the valvular calcification, or?
We did find, I mean, it was great fun also looking at these CT scans, which we did over a year. But we did find that 2 mummies of the 31 that had hearts, most of them had hearts. We actually couldn't realize what a heart looked like, a desiccated heart. But after reviewing so many mummies, we got pretty good at it. And 2 of them had clear-cut, rather dramatic mitral valve calcification, which I think is also the first finding of those as well.
So what do you think are the implications? I mean, if the coronary artery disease truly was more than 3,000 years old, what do you think about it? I mean, was it present then? What is the importance of increasing risk factors? What about the modern society, disease of the modern society or industrialization? What are we missing here?
I think there's a missing link someplace. I mean, we do know that Allison has shown that that the risk factors do predict calcification in contemporary humans, and others have shown that. Where if you don't smoke, if your cholesterol is lower, your cholesterol will be, your calcification that we have in whole body calcium scanning that Allison did will be less. So risk factors can decrease this calcification. But why a princess would have calcification in all her major arteries makes us think that we don't understand atherosclerosis as much as we believe we do.
Thank you very much, Dr. Thomas, for such wonderful, interesting, and the intriguing study. And you watch out for our April issue of JACC Imaging, where you would have all the results in detail. April 2011, debuting on American College of Cardiology annual scientific sessions in New Orleans. Thank you.
Thank you.